As you know, guys, we're in the month of October where we get to celebrate a Pride Month and also focus on a breast cancer awareness. Now, guys, do not forget to follow us on our socials, on Facebook, Twitter, Instagram, and the Sikolanagu YouTube, guys. I would like to give a big shout out though to our National Department of Health, our sponsor, for always standing behind us and supporting us in everything. Siyabonga kakhulu for just looking over our shoulders. So guys, walk with me as I'm about to have a conversation with Dr. BMT Shabangu, get breast cancer. Hi guys, I'm going to be sitting with Dr. Bongani Shabangu. Sawubona, doctor?
Yeah, sawubona sis. Siyaphila njani?
Ngiyaphila. So I'm just going to just ask for a breakdown where ukuthi yini kahle I breast cancer.
I breast cancer umdlavuza webele. Lokusho ukuthi ukugula okuphatha okutholakala ebeleni. Okuhambelana kungaba isigaqa o kungaba ibele lonke nje liqhamuke seligula. In commonly you find it in women as a lump, which may be palpable, which means you can feel it, or you may not necessarily feel it. In men, if it presents, it usually presents at an advanced stage because it's not common. It's about 1% of the population is affected by breast cancer. 1% of the population of men is affected by breast cancer. But females, it's very, very common. It's actually one of the leading, if not the leading cause of death.
Yes. Mostly
in women.
Okay.
Yes.
All right. So now that you've gave us like a young breakdown, I just want to know what are the common causes of breast cancer in both either female or male.
Okay. In terms of causes, we don't necessarily talk about causes. We talk about risk factors. Okay. Because when you talk about and it's in combination, it's not just one factor, but it's a combination of factors that predispose to the condition. Because now when you mentioned, I'll make an example. If we say smoking is a risk factor, that it doesn't necessarily mean that all smoking people will have breast cancer. So it's going to be a combination of factors. Commonly, which is known, is divided into two: sporadic cancer and hereditary cancer. Hereditary, which means it get passed on from one generation to the next generation. Yeah. And then the sporadic one, then it's a combination of these other factors. Okay. Things like age, for both males and females, age, diet, the environmental factors like toxins that you find in the atmosphere, pesticides, smoking, which is habits, and a previous history. A person might have had cancer before. You find that they are at risk of getting another cancer. So it becomes...
So it can change, basically?
The risk, if a person has had cancer before, we're talking about if they have had cancer before, they can still develop cancer on the other breast. Okay. Yes.
All right. So now, what are the maybe most common or frequent symptoms that one could experience?
Breast cancer usually doesn't necessarily present with pain, but the most common presentation is a lump, usually painless, but sometimes they can present with pain. But most commonly, the patients will present with no symptoms at all, completely asymptomatic. They just becomes an incidental finding. At screening, you find that women would know that probably from the age of 40, I have to go for screening, and incidentally they discover I've got a lump. So it's a lump. It may also be an ulcer on the breast, or it may be a rash, especially around the nipple, an itchy rash around the nipple, and it can also be a discharge, especially when it's a bloody discharge.
On the breast?
On the breast,
okay.
on nipple discharge, a bloody nipple discharge. Those are usually that's the usual presentation.
All right.
Yes.
So now let's go to the diagnosis.
Okay.
So what are like I could say what causes the diagnosis before or after finding out that you have breast cancer?
Okay.
Or the procedure rather.
So let's take it back to the symptoms. The symptoms that I mentioned, by the way, they're usually these are symptoms in early breast. In advanced disease, you find that a patient will come in with the complications or symptoms that are suggestive that the cancer is spread. They can come in with backache, sudden onset or new onset backache, even with paralysis if the cancer spread to the spine. They may also present with shortness of breath if it has spread to the lungs. The worst is a spread to the liver, where they will present with yellowness of the eyes, which we call jaundice.
Yes, yes.
So in terms of your question was on
the diagnosis procedure.
Diagnosis. Breast cancer, we say evaluation or assessment around breast cancer is called a triple assessment, which involves clinical information, the history that you take on the patient, and then imaging, which involves ultrasound and mammogram. Now we also include MRI, depending on what kind of patients we are dealing with. And then the last one is a biopsy. A biopsy, which is usually, we call it a needle, a true cut biopsy, where a needle is inserted on the lump of the breast that is affected. We take tissue to be tested, because we can only talk about the cancer once we've confirmed it on the tissue.
Oh, okay.
Yes.
All right, so now speaking of all those, the symptoms, the backaches and whatnot, it's making me think a lot. But anyway, let's just move right along to what the differences rather between men and female who have breast cancer.
Okay. There is definitely an anatomical difference between males and females. Males usually will present with the late, because again, like I said, that the tendency is men don't usually check what is happening in the breast. They will usually present at an advanced stage, and the lump is more prominent and easier to see or feel in males than in females. Females usually they've got, because of the anatomy, sometimes the lump may be not that discernible as compared to the males, but generally the behavior of the disease, both in males and females, is the same.
Okay.
Yes.
So now I would like to know, what is the procedure post-diagnosis now?
Okay, once the diagnosis has been established, then we do what is called staging. Now we've done the histology, we've confirmed that there is a cancer. We do a staging. Staging is a test that are done to check if indeed the cancer is spread, because the management also depends on whether the cancer has spread or not. Also, after we've diagnosed, then we also determine the stage of the disease, stage 1, stage 2, stage 3, depending on the size of the tumor, and also whether or not it has spread to either the armpit into the axilla, into the lymph nodes, or it has spread to the rest of the body. Okay, so once we know the stage, then we are able to decide if it has not spread. There is a package of treatment that is followed, versus when it has spread, and there's also a package that is followed for those ones.
All right, so just a small question on the spreading. Does it also go as far as getting you to have lumps under the armpits?
Yes. It does. Actually, part of the breast tissue, the breast drains, we say there is a lymphatic system that drains from the breast into the armpit, which we call axillary lymph node. So if the disease, it may go as far as the armpit. That's the first starting point. Obviously, that's not that, we don't call that a distant spread or distant metastasis. That's more like within the region, because when you operate, if it hasn't spread to the rest of the body, we're able to remove the lumps that are in the armpit.
Okay.
Yes.
All right, so just now for our audience, on where can they contact you for more information about this, because as you can see, I also have other questions on top of the ones I had. So where can they find you to either consult or just to find out more about this breast cancer?
Okay, I am based at Dr. SK Matseke Memorial Hospital in Soweto, Diepkloof. My office is number 18 at Nambula House. I've got an Instagram page I'll share with you. Okay. Once you've, I'm sure you'll give me some information. I'll share my Instagram page with you afterwards.
Or maybe just for now, you can just give us that name. I'm sure it's Dr. B Shabalala something.
Dr. BMT.
Okay.
Dr. BMT Shabangu, yes.
All right. No, thank you very much, sir, for your time.
Okay. Thank you.